Hey, Dana, we are live.
Hi.
Yes, yeah.
Hi,
So we are a
Thana.
bit early now, so just want to wait for people to drop in the call, or not a call, it's actually a talk, a live talk we have with you. So we'll start exactly at 9 p.m. It's now 8:54. For a couple of minutes, we just hang around here, chill out, and wait for people to, I guess, step in. How are you doing, by the way?
Good. Very good, very good. How
Very
are
good.
you?
I'm doing fantastic. Where are you now? Diana? Yeah,
I'm
we
in my
lost you there for a
clinic,
while.
Essence Clinic in Damansara.
Yeah. Oh, where again? I didn't hear you.
Essence Clinic in Ara Damansara.
Okay, sounds good.
Yeah. Nice backdrop.
Yeah, so this is actually my my YouTube page. So if people don't know, I have a YouTube channel. That's my page. That's my ex-lover, ex-car, and yeah, I miss it dearly. This is what I had. This is what I want to get to the Porsche.
Oh, I see.
Yeah. So yeah,
Okay.
setting my ambitions straight from the get-go. This is what I want. Not bad. We got 30 some people joining in already before the call. Con says, good evening. Evening, Doc.
Good evening. Hi.
Yes.
How do you see that? I would like to see how many
So,
viewers we have as well.
I think I see on my screen. I'm not sure that you can see. But we
Yeah,
got 41 people
it's
now
spread out.
on. That's fine.
That's fine. I'm cool.
Yeah. So it's funny though. I mean, I've never called you doctor, isn't it?
Yeah, I don't introduce myself as a doctor as well. I prefer
Yeah.
first name basis, just a bit informal. More personal and yeah.
Yeah, I guess so. 8:56. Let's give it a couple of minutes. People join in, and then we can start on our. I think it's a very interesting topic. People have misconceptions. People have, I guess, issues believing what's the truth. We got Chin Shi Chun joining us. Hi, Dr. Diana on the right.
Oh,
friend?
Dr. Chin's my partner on my
Oh, okay. Found us here.
my amazing mentor.
Okay, I think we're going to start very soon now. So as usual, in Horizon, we begin a video. We begin with an intro. So let's start with the intro from Horizon. This is who we are, the team, and so sit back and relax, and let's start the talk. You have no idea how many times I've heard that tune again and again in my head.
Well, I hear it personally every night as well, okay? Because of my husband, Mark. It's literally the last music that I hear before I go to sleep.
It's funny because sometime back I have the same habit of listening to Bobby and Con and Chris when I'm sleeping, and my wife will know the voice from the voice. Who is that? Oh, that's Bobby, or that's Con, or that's and it's and then So and then now when I do videos with obviously the Horizon team, it's funny because I do my video editing, so I got to listen to the same tune again and again and again. So yeah, it does get very interesting. Very catchy
Well, the
tune.
thing is, whenever Mark watches a video that you're in it, I'll scream from wherever I am. Oh, that's Thana.
Yeah. So again, this thing I'm doing now is called Thana and Friends, and Diana is a friend, and the idea is I'm calling someone that's a friend of mine to come in every week to talk about a topic. And I know Diana through my friend Mark, and we're now close friends. It's been, I think, about 2 years now that we know each other. So yeah, it's been a fantastic journey. Thank you for having me as a friend, and thank you for joining us today in Horizon to talk about a very interesting topic, which is the post-COVID syndrome. So I guess before we begin, how was today's stats? Did you have much look at today's numbers where we are at?
Today, I think we had like 6,000 over cases today again.
Yeah, it's not going
Unfortunately,
down though, isn't it?
it's not, because personally, I think compared to the first MCO, which is back in March last year, people are much more afraid back then, and people are actually not leaving their house. Whereas, apart from shops closing at 8 now, and more people are working from home, you still see crowds out there. People are still going grocery shopping in pairs instead of alone. I
Yeah,
guess people are just they're just a bit more, they're tired. It's a fatigue, isn't it?
yeah, it's
From
tight.
following all this SOP.
Hmm. To those people who don't know you, Diana, could you just give us a background of, I guess, your background in Malaysia as well as abroad when you're studying? So I think, yeah, could you start off with
Yeah.
that?
So, those who don't know me, I am Dr. Diana. I studied in University of Bristol in United Kingdom for my medical degree. And then after completing my degree, I worked for 2 years in the UK, in Cardiff. Following that, I returned to Malaysia. And then during my time in Malaysia, I've worked in HKL in general surgery. And then I moved to HUKM, where I work as an eye doctor, ophthalmology. So yeah, um, been to two different hospitals, but now I've exited from government practice and yeah, joined the private sector.
And I think that's when the outbreak happened, because I think the first phase was last year, and you were in the
Yeah.
front line in Japan when that happened. Maybe tell us a bit
Yeah.
about that incident.
So in the hospital, because HUKM is actually a semi-private hospital, so we're not like Sungai Buloh and HKL. Initially, we weren't really accepting too many COVID patients, but we're still helping and playing a part. So because back in the days, contact tracing and close contact is viewed very seriously. So whenever you're a close contact, you will be sent home from work, you'll be asked to quarantine and isolate until further advice. So there was a period of time where our emergency department were very short of staff. So the HR had to mobilize doctors from different departments to the emergency department to help out. So I was sent from my department to help in the emergency department during the first wave. Um, After that, when the cases start dropping, then we will send back to our respective departments. But then when cases start going up again, early of this year, during the second wave, then we were deployed. For a better word, we were deployed to the COVID wards again. So it's
Wow.
out of our comfort zone. And if you imagine, like, COVID cases ideally should be handled by a medical doctor with a like interest in the medical specialty, or
Yeah.
respiratory physician or anesthetist, whereas you're having eye doctors looking after your lungs,
Wow.
and you're having a urology doctor, an ear, nose, and throat doctor. But
Yeah.
it's out of our comfort zone, but we need the staff, so you can't really do anything about it.
It's like all hands on deck. You have to be there and help out.
Mm,
Yeah. Yeah.
correct.
Mm.
And so I
Wow.
went from just having to look at someone's eyes to having to like refresh my medical school knowledge on my lungs and everything else.
Yeah. I mean, it's a very interesting take having you today, because obviously you are a young doctor, and I think a lot of the younger generation have a sense of immunity. They feel they're immune to this because they are strong and they can fight it, and it doesn't impact them. But I guess today's topic is very close at heart because it talks about post-COVID syndrome. And I didn't know about this until you spoke to me, and I was like, wow, post-COVID syndrome, what is that? And it caught me off by surprise. So I guess, what is post-COVID syndrome to begin with?
So I think a lot of people, they think that, oh, okay, COVID, you have a bit of flu, a bit of fever, If it's very bad, you might get short of breath and you go into hospital. But those who are not very bad, you a bit of symptoms and you recover from it and you think that that's it. But unfortunately, that's not actually the case. We're seeing a lot of people coming back to like GP clinics and all that, um, complaining of persistent symptoms. And KKM recently released like a guide, an information leaflet just yesterday on the long COVID symptoms. And basically, we define long COVID symptoms as any symptoms that has persisted beyond 4 weeks after your COVID diagnosis. So usually, say you have like an influenza, a cold, a flu, or whatever, you recover fully from it. But what we're seeing more and more in patients who had COVID is that their symptoms doesn't go away. So you're coming back to the primary care with persistent headache, fatigue, muscle ache. You know, a lot of people are saying they're having like a mind fog, they're losing memory.
Memory.
Yeah,
My God.
not say like you don't know like to the Alzheimer to that extent it's not, but you do find that you forget where your keys, you know? You
Mm.
forgot like what you wore a couple days ago. It's just a
But
bit of a brain fog.
so will this be like, I mean, is it like what, 1 month, 2 months? I mean, do you have enough data to talk about it to be what? Is it going to be lifetime? I mean,
No, no, no. Of course, this is a new disease, so we don't know how long that will persist for. Now, I'm talking about there's different types of long COVID syndrome. The minor ones are like muscle ache, fever, loss of sense of smell, headache, hair loss, and all that. That one is yet to know how long that will last for. But we're also seeing a lot of issues with permanent lung scarring, you know, from very severe COVID, liver scarring, liver cirrhosis, hepatitis, and you're seeing that your whole blood sugar is deranged. Your diabetes control is suddenly very bad because of all the steroids you had as part of your COVID treatment. So there's almost like two categories of post-COVID issues, be it the minor ones in those who have like stage 1, stage 2 COVID, and the more significant ones in those who require hospitalization. So yeah.
wow, it sounds really scary. So when you say scarring of the lung, what I mean, what is that like? Is that like a permanent scarring for life? You can't breathe the way you used to.
So when we call scarring, a medical term that we call it is lung fibrosis. So you
Mm.
know all the X-rays and all the CT scans that's been shown around from COVID patients. COVID causes very significant inflammation in your lungs, in your airways, okay? And it's quite often it also causes microthrombi, which means small little blood clots that's just sprayed all over your lungs. It doesn't cause significant blockage in the sense that you drop down and you can't breathe, but it impairs your lung gas exchange. And this lung scarring fibrosis, there's no cure. A scar is a
What?
scar, you know, a scar is
Wow,
permanent.
wow,
Okay? Unfortunately,
wow.
our lung doesn't have that great of an ability to heal itself. So we're these patients who required hospitalization or those who survive an ICU intubation episode, those scars will be with them for a long time.
That's scary because I mean this is the current stats now, and you say like confirmed cases of in Malaysia is about 1.93%. Means you're saying that potentially 2% of the population right now, as of now, because it's a growing number. The number is growing day
Yep.
by day. They could be ending up with long-term health effects, for the rest of their life.
Yeah. I mean, you have to minus the 3,611 people who
Yeah,
unfortunately passed away from it.
that's an
We're
extreme.
yeah, we're seeing a lot of COVID survivors, and this will pose a significant impact and burden to our healthcare in the future, definitely.
Mm. And I guess the other number here interesting is that 20% of people in Malaysia are vaccinated. I mean, I got my vaccine on 7th of May. I'm still alive. I'm healthy.
Congratulations. Great.
But I guess, I mean, that number is appalling. And I think part of the discussion today, it's about awareness and about people to come on board, sign up for vaccines. There shouldn't be any excuse from the government to say that people have not registered for vaccines, because these are people who have registered, and that number is just still not where we're supposed to be, you know.
Yeah.
So yeah, it's
Definitely.
an interesting number, you know. So moving on, what do you say about vaccine efficacy? And also, so I think the my interest in all this vaccines and all this began with this video I saw, and I'll show you in the video shortly now. It's about vaccine efficacy,
Sure.
and I think that's why a lot of people in Malaysia initially, like my family, no one wanted to take vaccine. No one. My wife told me literally to say that if you go and take vaccine, my wife is listening to the video right now, she's going to kill me. Said, if you go and take vaccine, I'm going to disown you. Why are you taking a risk with your life and going vaccine? You're a father of 3. You are taking a risk by going for AZ. So it came to that point. We had a fight, an argument, and I said, nope, I'm going anyway. And then after I went, it was all fine. And she's like, oh yeah, I want to go also now. And she's going to get a vaccine next week, I think. So yeah, so even people who are educated, young people, people who are knowledgeable, they want to go for Pfizer. And I think the study of efficacy is something that's very key. And let's just listen to this video from this mayor from US. And I think it's very interesting to hear what he says.
Okay.
Are the best. And I am going to do everything I can to make sure the residents of the city of Detroit get the best.
He was referring to these numbers, the vaccine's efficacy rates. The vaccines from Pfizer, BioNTech, and Moderna have super high efficacy rates, 95 and 94%. But Johnson & Johnson, just 66. And if you only look at these numbers, it's natural to think that these vaccines are worse than these.
And I guess that's the beginning of how people were scared of taking the AZ vaccine. And to add to that, this is a chart. Probably you can further elaborate on this.
So yeah, basically what it's trying to say is that you can't really compare the vaccines against each other because they're all different. So for example, Moderna and Pfizer, the trial was run at a completely different time. It was run around August of last year, whereas the Johnson & Johnson is towards the later quarter of the year. And as you can see, when Moderna and Pfizer's trial was run, there are significantly less cases of COVID compared to when Johnson & Johnson had their study done. And by the time Johnson & Johnson did their COVID study, there's already like presence of different variants of COVID, different strains. So it's not really a fair comparison when you want to compare between vaccines. It's like comparing an apple to an orange.
Yeah.
Yeah.
And I think that's a very important message, because I guess right now I think what they're coming back to say is that all the vaccines have got very high rating in terms of its efficiency. And yeah, and people are still getting scared. People are still shopping for vaccines. It's sad. I saw a article in the Star the other day. I think a group of 10 elderly people went to Penang, and they said no to the virus, no to the vaccine, sorry, because they want to get Pfizer. They said we don't want AZ. So, and then they walked away. And you were telling me the fact that they need to have X number of people in a row to have the vaccine delivered. If they can't do it, isn't it?
Yeah. So
Yeah.
I think what people misunderstood is, in like as doctors, scientists, we learn how to analyze results and we learn how to read scientific papers. Whereas what the information that's being fed to the public at the moment, they're just figures that's been taken out of context. Okay, so people want Pfizer, people want Moderna because the efficacy is very high, 95%, as compared to Sinovac, which is like 50 something percent, and AstraZeneca 60 something percent. Now, what they need to understand is that this efficacy is basically looking into what are your chances of not catching a symptomatic COVID-19. Means you catch COVID and you have symptoms, okay? But that is not what we should be looking at to begin with, because all the vaccines have been shown to be effective in preventing death and hospitalization. So I think this is a very good animation for people to understand. So of course the ideal vaccine is something that can prevent everyone from catching the infection. Okay, so it's basically eradicating the virus, but that is in the ideal scenario. So that's what we are unable to achieve. But the next best achievement that we could get is to prevent people from catching severe COVID symptoms, from being hospitalized, and from dying from it. So it is completely all right to get COVID and to have some minor symptoms. That's fine, because that will just be like a minor flu. Every year we're giving influenza vaccine. Every year people are having flu, you know, but you survive and you recover from it without any long-term sequences. So that's what the vaccine aims to achieve, and that's what it has achieved. Okay, so another thing is you can't compare the efficacy just based on the numbers, because they're all different vaccines. All these trials have been run in different countries at different time. The inclusion exclusion criteria are different. The patients that's in their study is different. So as professionals, as doctors and scientists, we'll know not to compare these vaccines like that unless you have a standardized trial for all vaccines done in a standardized manner. Otherwise, it's not fair to compare like AZ to Pfizer. You know, it's run in such a different environment.
Yeah. Yeah, and yeah, so I think trust the government, trust the system, trust the doctors that are taking care of the situation, and we got to build the system. Let's get some comments that we have over here. So we've got one from Sridhar Arunagiri Nathan. I mean, I can't help you. So hi, doctor. I did my swab test today because of a close contact. My question is, if I get my test from positive, what would be the next procedure? And I'm currently studying in the university. So he's positive, and
Okay.
I guess what does he do?
Sorry. Can you repeat the question?
So it's on the bottom screen there. So it's he did his test today, and because of a close contact, he's saying that if he's now positive. Oh, we've lost Dr. Diana there for a while. So he's positive, and the question was, what does he do as the next course of action? Well, Doc is back.
Hi. Sorry. Technical
Yeah,
glitch.
you're back. That's fine. So, Doc, the question was, this person did the test today, and he's now positive. What should be the next step in the process?
You need to contact the COVID assessment center in your state, okay? Because you'll need to go there to be assessed by the doctors and the nurses there, whether you're suitable for home quarantining, or do you need to go to a quarantine facility, or do you need to be admitted to hospital. So it depends on quite a few factors. For example, if you're studying in university but you're living at home, and your house you have your own room with your own ensuite toilet, and your family members are able to take care of you, and you're feeling fairly okay, your vital signs are fine, then the COVID assessment center, the doctors there will allow you to quarantine at home. So then you just stay at home for 10 days, and that's it. But if your living situation is not very ideal, you're sharing a room with your siblings, for example, then, or you have very sick and elderly people at home, then they might bring you to the quarantine facility to enable you to quarantine there. But if your symptoms are quite bad, or if you have any underlying medical problems like severe asthma or immune deficiency, and you need to be closely monitored, then they might bring you to a hospital. So you need to contact your PKD, your Pejabat Kesihatan Daerah, or your COVID assessment center. You need to go.
So the fact you go to, let's say, to a path lab and get a test, that is not enough, isn't it? You got to contact your KKM office.
You need to bring your result there.
Oh.
If your result, okay, it depends on, there's different types of tests for COVID, yeah? You have your RTK, rapid antigen test, and you have your polymerase chain reaction PCR test. So the PCR test is your gold standard. If you've done the PCR test in BP lab or KMJ or anywhere, you can bring those results to your COVID assessment center, and you can contact KKM with that. But if you've got a positive result on RTK antigen, usually the cheaper COVID test, that is not 100% accurate. So I would suggest that you repeat another PCR test in case it's a false positive.
So yeah, so Sridhar, I suggest if you need an RTK, you should do another test and contact your local KKM. So you got Eugene here. This is Mr. Average. Sorry, average saving. Eugene, what is your opinion on mix and match vaccines like how we mix different soda drinks at the soda machine. Some articles say mix and match triggers stronger, more robust immune response in your body.
Personally, I will not recommend that. There's not been any research done at the moment based on mixing the vaccines together with very good results. And also you have to understand, like Pfizer, Moderna, they are mRNA vaccines. Okay, AstraZeneca is a viral vector vaccine which uses the chimpanzee virus. And then you have your Sinovac, which is an inactivated vaccine. So all these vaccines are functions differently. They deliver the message to your body in a different manner. And the reason you need a second dose is because usually the immune response mounted to the first insult, which is the vaccine, is usually not sufficient. So you need a second dose so that you can mount a good response to it. If you're delivering vaccines in a different way, your body has to reanalyze the code every time. So it doesn't really work. In the future, whether you could have taken Pfizer this year, AstraZeneca in a few years, possible. But in the meantime, I wouldn't recommend mixing the different vaccines and just stick to whatever vaccine you can get, the quickest way possible.
So Eugene, I hope that answers your question. The next one, this is actually my own brother. So my brother is asking this, Siva Krishnan. So who is more affected, a heart patient or a diabetic patient?
Okay, again, this is a very difficult question to answer because COVID can affect you in many ways, okay? So you have to understand one of the main treatments that's been given to COVID patients in hospital is steroids, okay? Because COVID causes significant inflammation in your body, everywhere in your body, your lungs, your liver, your colon, even your heart, okay? So steroid has an unfortunate side effect in that it increases your sugar level. So usually what we see in our diabetes patient is that their sugar becomes all over the place. It's absolutely crazily deranged. So for example, prior to catching COVID, you're good on just a few tablets, your metformin, your glucophage. But while in hospital, you require insulin because what we're giving you is affecting your sugar that much. Now, another thing to know is heart patient and diabetes patient, sometimes most of the time they run in pairs. Diabetes patient, they have usually, you know, what we always say, you have your high blood pressure, high cholesterol, and diabetes. This is a package, okay? And when people who have this package usually doesn't have a very strong heart as well. So usually they confound each other and they usually have some problems with either sugar or heart. So another thing about COVID is that it makes your body go into a procoagulant state. You're very likely to form clots in your body, clots in your legs, clots in your lungs, clots going to your brain, which will cause stroke, clots going. Patient who has diabetes and the patient who has heart problems both will not do very well with COVID.
So I guess the short answer is yes, there is. I guess there's more impact from COVID, not from vaccine, but more impact from COVID itself to anybody who's a heart patient, diabetic. And I guess so that's why they are more. It's more important for them to get vaccinated than anybody else.
Definitely, because if you look at the statistics from HUKM every day, you look at everyone who dies, and their comorbidities are all the same: diabetes, high blood pressure, high cholesterol. One of them will have one of that. All the 50-year-olds and 60-year-olds, you don't really see a lot of fit and healthy individual dying. Of course, there will be a few young ones who die. We don't know what's the reason, but if you see the common theme between all these patients who died, they all have an underlying medical problem, be it diabetes, high blood pressure, or cholesterol.
Yeah, thank you, Mr. Siva. Next one is from Mr. Janardhan Velapan. If I get infected, hopefully not, how long it would take for me to transfer the virus to others? Is there a grace period?
Okay, usually what we will say is your most infectious 3 days, the 3-day period before you start showing symptoms. So you won't really know that. For example, you started having sore throat and fever today. It means that you've been infecting a lot of people in the last 3 days that you were asymptomatic. Once you start developing the symptoms, your infectivity rate actually decreases. and by day 10, from either from your positive swab result or from your onset of symptoms, we classify you as not infectious anymore. So really, it's the few days before you start showing symptoms.
Okay. We got more questions here. Let's cover them. David Miguel Co. Hi, Dr. Diana. My father-in-law was given second dose appointment 12 weeks from the first dose after taking the first. Received a call a few days later, only be told that his second dose appointment interval will be 3 weeks from the first dose. Should he be concerned? Male, age 71 years.
Okay, at present, Malaysia government is offering 3 types of vaccine to the public. Okay, you have your Pfizer, you have your Sinovac, and your AstraZeneca. Now, if your father-in-law received Pfizer or Sinovac, you need to repeat your second dose within 3 weeks. Okay, but by the 3rd week. So that's the recommended interval by the pharmaceutical companies. But if your father-in-law received AstraZeneca, now AstraZeneca is licensed to have your second dose between 4 to 12 weeks after your first dose. So if your father-in-law had Pfizer and Sinovac and his second dose is 3 weeks, I would say no issue with that. If your father-in-law received AstraZeneca and he's getting the second dose 3 weeks later, also no issue with that. Having it earlier doesn't cause much of a problem.
Okay.
Having it too long might reduce the immune response that you mount. So I wouldn't be concerned about it.
Okay. So you got one from Theban Naidu here. Okay. Is wearing 2 surgical masks, does it reduce the risk of getting infected with the virus?
Okay. To be honest, if you're wearing a single layer of mask, is a 3-ply mask and is well fitted on your face, okay, it's quite safe. It's really offering good enough protection. Now the issue is we see a lot of people with the mask being a bit loose on sides and all that, and you're not wearing it in a very right manner. Then of course if you have double the layer, then double the amount of material that the virus has to cross through. So of course 2 is better than 1. You can wear 10, that's even better, but whether it's
And you
feasible
can't
or
breathe
not.
then. But I guess the second layer, it's more of to give you that the fit so that it's just tight in your face and you have no gaps in between.
And I guess extra protection. If someone keeps spitting saliva on your mask, over time it might soak through. So if you have 2 layers, that will delay that.
Okay, we'll take a few more before the half-an-hour break.
Okay.
So we got T. Guan Lau. Hi, Dr. Diana. Currently in the US government is giving a green light for their public to go unmasked in public areas after they had their full 2 doses of vaccine. May I know what is your opinion? Thanks a lot.
Okay, I think it's a bit tricky. Okay, even back in the height of COVID, US citizens are not very keen on wearing masks. Okay, as compared to our Asian counterparts. Now, US has managed to vaccinate quite a big portion of their population compared to Malaysia. So they are towards the right route of getting a herd immunity. Okay, and their cases have been constantly dropping and the number of deaths has been dropping. I think it's okay if majority of your public is vaccinated, because that is the goal that we're aiming for, to have herd immunity so that life can somewhat return to normal. But Malaysia is a long way from there.
Yeah, a long way away. I guess
Long.
herd immunity, I mean, you hear this a lot about being herd
Yeah.
immunity. What is actually herd immunity? I mean, to me, I think of it as if by some magical force being, everybody is now immune to it. What is actually herd immunity all about?
Herd immunity is basically the goal is that you want to vaccinate enough people in the population so that you provide immunity to those who doesn't get vaccinated as well. There will always be people who are very frail, who are allergic to the vaccine, who are pregnant, babies, There will be a certain number of people that you can't have the vaccine. Now, what herd immunity gives is that if you have enough number of people in a given area vaccinated and they do not develop symptoms and they do not catch COVID, then the risk of transmission is lower. So in the end, you'll offer herd immunity to people who are not vaccinated as well.
I see. So we got Mr. Korn here. Mr. Korn, is it true that heart patients are advised against taking AZ vaccine?
Okay, so at the moment, that is absolutely not true. The only contraindication or precaution towards any vaccine, not just AstraZeneca vaccine, is if you know you have a specific allergy to a specific component in the vaccine, or you're pregnant, so you can't take AstraZeneca vaccine, you're a child, or you know that you're prone to suffer with clots, and you just have a higher risk of clots, then you might want to choose for a different vaccine. But people who have any heart problems, lung problems, liver problems, any comorbidities, you should definitely, you can take the AstraZeneca vaccine, no issue at all.
So we got Ms. Lashmi here. How long does the vaccine take to get activated?
Okay, I think what you want to know is how soon after the vaccine that you mount an immune response to COVID. So it depends on which vaccine you're taking. So for example, Pfizer, it's said to be able to protect you within 2 to 3 weeks after your second dose. Every vaccine is basically after your second dose. Okay, so after your first dose, you hear people saying that, oh, so and so got vaccinated, but then they still caught COVID. That's because your immunity is not strong enough if it's just after the first dose or immediately after the second dose. So I would say just on average about a month after your second dose.
Okay, so it's our halfway point here. I want to just keep to the timing. We're going to do a quick commercial break from a sponsor. This is obviously Horizon, and today's sponsor is the Evo Club Insurance. So yeah.
Saving of 500 bucks. You save about 1,000 plus.
To work out cheaper for me.
4,000.
215, even more.
It's for 200 plus. 400 bucks of savings.
Welcome back, Thana.
That was a very short break.
Yeah, short break. We're really ringing you here with all the comments, but the comments are good. Yeah, please keep it coming. Please, if you like this content, please give it a thumbs up, like, share, subscribe. No, not subscribe. It's like and share and comment. So used to doing YouTube videos. So yeah, keep it coming, and we welcome the questions. The idea here, it's about public awareness, about getting it out there, the right information. Like I won't be able to tell you, but the doctor is here, the good doctor, and she can tell you the facts. Before we go to the next topic, you want to take some more questions, or shall we go to the next topic at hand?
Up to you. I'm good with anything.
Okay, let's do on blood clots. I think the biggest issue in Malaysia, the biggest topic is blood clots on AZ. I had the concern too, honestly speaking, because I went through and going like, okay, is it 4 over a million? Was that the number? Something like that. So I was like, okay, fine, whatever. I took it as more of a social responsibility. If I don't do it, who will? I must go it for the community to get community. So I went and did on that basis. But after I went for that, and you're talking about, blood clots isn't what you think it is. So maybe just explain to us about this blood clots that we hear a lot about in the news.
So I think even my husband is concerned about this. So people around me are concerned about it, and I had concerns for it when it first surfaced in the news. But what we can see is WHO has looked at the data and everything, and they've recommended that AstraZeneca is still safe to be used by people. Okay. Now you have to understand that. So the risk of you catching a clot if you're COVID positive is 8 times higher than the possibility of you getting a clot from AstraZeneca. Okay. And personally, from my experience of looking after COVID patients in HUKM, most of our patients end up having a clot. Majority of them end up having a clot. And
wait. So you're saying it's more likely you have a blood clot from the virus itself
than the
vaccine.
Okay. So, and because I know this question will be asked, so I just did some literature search like a couple of days ago. And recently in Oxford, they run a retrospective review through their computer database of over the last 1 year. They included about 500 over 1,000 patients from their database on and comparing those who had COVID, those who received Pfizer, and those who received AstraZeneca. And what they found is that the risk of developing a clot in AstraZeneca is about it's about 5 in a million, okay? Whereas the risk of developing the same clot from Pfizer is about 4 in a million.
Oh,
Okay?
it's about the
So
same.
this research has just been completed a few months ago. So it's actually
Okay.
about the same. Now, the risk of getting a clot from those COVID-19 positive patients is about 35 in a million. So unless COVID has been eradicated from your country, the chances of you catching a clot from being infected with COVID-19 is significantly higher than the risk of you getting a clot from AstraZeneca. Now, another fairer comparison is that, you know, obesity. Okay,
Yes.
when you're obese, you're in a prothrombotic state as well. So actually, the risk of you getting a clot from being overweight alone is already higher than the risk of you getting a clot from the vaccine. So if
And I guess what are actually blood clots? I mean, we think of blood clots, it's like we see CSI or we see House, and there's a blood clot and someone just passes out and then they die. So I mean again, to the non-medically knowledge, where does this blood clots happen and how severe are the impacts of blood clots?
okay, blood clot is basically like a congealed blood within your vein or your artery. Okay, the clot is basically like a block, a drain. Okay, it blocks
It's
the
like what?
flow of
When you say
blood.
congeal, does it mean like a jelly, or is it like what? It becomes
It's a
becomes
clot.
hard?
How do I explain a clot?
Okay.
It's basically your blood is supposed to flow in a liquid form,
Yeah. Hmm?
but it becomes a clot and it
Oh.
blocks your vessel. So blood can't flow from A to B because there's something blocking it. So that's a clot.
Hmm.
And a clot can form in many areas, your lungs, your livers, anywhere that you have a vessel, a clot can form. So commonly, people who have stroke had a clot in the vessel that supplies the blood to your brain. Those who have a heart attack had a clot in the vessel that supplies your heart. So it depends on where the clot is. Now for AstraZeneca, the clot that they've been talking about is the central venous thrombosis. It's actually a vein clot that drains the blood from your brain. So it is a very, very rare type of blood clot, and it's just a very rare disease that could be confounding, that because you've given AstraZeneca to so many people, and these people are bound to get that clot anyway, and they just so happen to have AstraZeneca. So I don't think we have sufficient data to really say that it causes or it doesn't cause. Yeah.
And again, what's interesting from your study from the UK study was that it's about the same chance of getting a blood clot from Pfizer as you would
Yes.
get from AZ. And see, this is
Correct.
something I didn't know before today. So that's pretty interesting, isn't it? So anybody out there who are shopping for vaccines, stop shopping, because either way it's the same thing. There's no difference one or the other.
Yeah, I mean, in an ideal world where vaccines are available at your disposal, where you can choose whichever vaccine you want, and the COVID cases are very low in your country, so the chances of you catching COVID is very, very low, and you want to shop around for vaccine, by all means, you can do it. But in the current pandemic in Malaysia itself, I do not think we have the luxury to be shopping around for vaccine. What you want to do is protect yourself against COVID. You don't want to die from COVID, you don't want to hospitalize from COVID, and you don't want to suffer severe symptoms from COVID. So any vaccine is your best bet.
Yeah.
You know?
So talking about medication, I mean, there's a question here from Gary Chin. HUKM running trials on ivermectin. What's your opinion on ivermectin?
Okay, ivermectin is commonly given to animals. Okay, it's part of the deworm things, like an antiviral, anti-parasite medication. My opinion on ivermectin. Okay, Ivermectin has actually been used in a few hospitals before KKM started doing this trial. But
Okay.
to be honest with you, all the medications that's being given to patients, none of them really cures COVID, unfortunately.
Wow.
It's a lot of stuff that we're giving to the patients. We don't really know whether it works. So my opinion on ivermectin is that no harm, have a go because you have no alternative to that. You have
But this is
nothing else. So
this is
why
at
not?
the hospital. This is not for the public, I guess. At the hospital,
Oh no, this is
if you have,
definitely not for the public.
yeah, exactly.
When you give ivermectin has its side effects. So as when we give to patients, we have to monitor their liver profile, their white blood cell, their platelets, and everything. It's not something you'll be able to get it over the counter.
Yeah.
So my
So,
opinion on that is fine. Leave it to the trial and see what the trial results show.
and I guess that shows paints a very grim picture because doctors were desperate. They need to do something to get the patients to recover,
Yeah.
and they tried many things to save life, I guess. So that's the grim picture that was happening and happened in Malaysia. Okay, so more questions. I like questions though. It's interesting. Devendran Ravindran, if we get into hospital due to COVID, how many minimum days will we be admitted?
Okay, if your symptoms are so severe that you require hospitalization, we will keep you for 10 days minimum before we will discharge you. At day 10, we either count it from the day you have a positive swab result or from the day of your symptoms if it's very clear cut. By day 10, we will discharge you and you will be deemed to not be infectious, but we will still recommend you to isolate and wear PPE from your family until day 14. So 4 extra days at home, just take the precautionary measures, but you'll be fine. So minimum of 10 days of admission.
So after you have recovered, you become
Yeah.
negative. It's 14
You
plus
don't
4.
become negative. Now, we do not repeat swab after you have COVID-19 because you can
Oh,
have a positive swab result up to 3 months. So we do not repeat
wow.
swab. You can still be positive up to 3 months, but after day 10 of catching COVID, you're no longer infectious to other people.
I see.
So we do not repeat swabs.
Okay. We got Tibu Naidu here. How doctor define sporadic infection? I can't understand that.
Okay, sporadic infection. Basically, most of the time, when someone is positive, we'll be able to trace it back to someone who is positive, who passed it to someone who's positive, who passed it to someone to positive. That's through the contact tracing. What sporadic infection is that someone has COVID-19, but you do not know where that person caught the COVID-19 from. So we call it a sporadic infection. It just happened to that person. We don't know how he got it. We don't know where he got it from.
Also, so it's like, I mean, you can't trace that source of infection,
Correct.
but the person is positive.
Yeah.
Okay. So it's like a non-cluster, so to say.
Yeah.
Yeah. So we got David Nigel Cole. If you were in their shoes, breastfeeding mothers should or should not vaccinate?
Definitely vaccinate. I mean, I'm not a mother, so but all my colleagues who are breastfeeding, they've all taken their vaccine because that is more important. You need to be alive for your child before anything. So I will worry more about catching COVID than worry about what the possible side effects from the vaccine.
Well said, well said, well said. We got Mike Yap here. Mike Yap from DNA Tuning. Shout out to DNA Tuning. Check him out for tuning your cars. If you want to go more powerful, more better, and have more zing in your in your drive. Is it true that after your first vaccination, your body immunity is very low?
Okay, this is a myth. Okay?
Oh, myth.
Yes, this is a myth. After you receive your vaccine, what it does is it triggers your immune system in your body to mount an immune response to that specific pathogen, which is your coronavirus. Your body is working overdrive to mount a response to that. Doesn't mean your body is not able to fight other pathogens and other viruses. So you might be after vaccine, you might get some side effects like fever, flu, tiredness, and headache, and whatsoever, those short symptoms. But it doesn't mean that your immunity is low at that time. It doesn't affect your immunity. No.
Wow, we're learning so much today. I think so. We got one. We just want to keep on going to the questions over here because I think they're all important. Because I think going through the questions, I myself am learning so much from them. So Derek Lim here, for COVID-19 patients discharged from hospitals or quarantine center, advisable for them to get medical screening several months later. I mean, you mentioned that they become positive, they remain positive for a few months. But I guess the screening, what screening is possible, I guess, for them?
Well, for me, I'm pro medical screening. Okay, I'm pro prevention is better than cure. So, if that you can find any reason to go for a medical screening, that's always great. I applaud that. But I wouldn't say it's necessary. Okay, if you feel fine, you're completely asymptomatic, you had a minor COVID, I don't think it's necessary. But if you want to do it just as part of a good healthy practice, healthy lifestyle yearly screening, then by all means do go ahead.
So talking about that, once you're infected with COVID, could you get COVID again? Is that possible? Is that a thing?
Yes, definitely.
Oh,
So
really?
at the moment, the research has shown that 3 months after you've catch COVID, it's unlikely for you to contract it again. Unlikely, but still possible. Okay, but as you know, the virus are mutating every day. So you might have developed an immunity towards the strain that affected you. In a year's time, in 2 years' time, when the virus has replicated 10 times, 20 times, a million times, you are susceptible to it again. Yeah.
Wow. So how do you know that you're positive if you always are positive? That makes sense. You know what I mean?
Usually,
Because
what we've seen so far is up to 3 months. After 3 months, it should be negative.
I see. So you will come to a point that it will show as you being negative.
Correct.
Okay. Yeah. So this is Eugene. So Eugene was positive from her wife. His wife is actually a doctor. He's a patient. Is recovered, vaccinated. Is he super safe? I guess yes. That's I guess you're safe for now.
I guess you are in a better position than people who are not vaccinated and people who have not had COVID. But super safe, like I said, if we have new strains coming, you're just as vulnerable as anyone else. But so far, AstraZeneca and Pfizer have been shown to be effective against the new strains too. So I think no one will be super safe for the rest of their life. And what I foresee is that there will be booster shots, yearly vaccinations happening in the future for vulnerable groups of people. Because the virus just changes all the time. It'll be like a flu vaccination. Yeah.
I mean, it opens up an interesting topic because, like yourself, Diana, you are a young doctor and you got your whole life ahead of you being a doctor, and I guess the whole scene of medicine is going to be different. You're going to see new types of diseases. You're going to see new types of post-COVID syndrome. So they say people are. I mean, it's just mind-boggling the fact that we are looking at yearly booster shots. You know. Yeah, I pity our doctors in the future. It's going to be a tough one. We are actually going very well with questions. We're going to go to now with treatments. I guess we talked a lot about the whole idea of the fact that there are post-COVID syndromes, the fact that you become COVID positive and you could develop, I guess, syndromes. And the question is, what treatments are there for long-term COVID patients? You know.
Okay. So, as I mentioned earlier, there's quite a lot of problems that's associated with COVID. If you're one of the lucky few that has no symptoms from COVID and has no symptoms after COVID, great for you. But unfortunately, that is not the case as we can see in our GP clinics. A lot of people are having long-term symptoms from it. So, we're seeing a lot of cases of people coming in with persistent fatigue, nausea, loss of appetite. Like I mentioned earlier, mind fog. A lot of people are coming in with extreme patchy hair loss, and then it's because at the end of the day, it's inflammation. Your body's immune system is gone haywire, is doing things that it shouldn't be. So we're seeing a lot of post-COVID patients with hair loss. So you end up with patches of bald hair, and these are in young working adults. So that's really unfortunate, you know. And then yes, Thana, don't get COVID.
I
And
like
then
my
we're
hair.
seeing a lot of patients. We're seeing a lot of patients who in which they are now insulin dependent after being very poorly controlled their lungs because of the scarring, so they get persistent breathlessness. They're no longer able to jog their 5 km, 10 km. They can barely walk up the stairs. We're seeing a lot of those cases. So I guess what I want to highlight today is that there is hope for this patient. Unfortunately, in the government sector at the moment, all these patients who suffer with post-COVID syndrome have been put on more of a supportive and monitoring policy. So you go back for your follow-up and they'll take some blood and they'll just see how you are. But they're not really able to offer you anything that could repair your body. So what I would like to bring an awareness to today is the possibility of using mesenchymal stem cells and exosomes for COVID-19, post-COVID-19 or during COVID-19 recovery. Okay, so I'm sure people have heard about stem cells, but they probably do not really know what are stem cells. So stem cells are a very basic form of cells. It has the ability to differentiate into any cells in our body. Essentially, human starts in the womb of the mother as stem cells, and the stem cells divide and forms different structures in the body. Okay, whereas exosomes, which I think people are not too familiar with, they are basically messengers. They are vesicles that are secreted by your stem cells that goes all over your body and goes towards areas that requires healing. So for example, you had a very bad bout of COVID, it's affecting your lungs with severe inflammation there. The exosomes will be able to travel all over your body towards your lungs, and then it can instruct your lung cells to repair itself. Whereas stem cell will be able to move itself to the lungs and divide into new stem cells. So that's how you differentiate it. One, stem cells, it can become the cell, whereas exosome is not really a cell, it's a messenger that tells your body to heal itself. So at the moment, what we could offer, for example, in my clinic, is stem cells and exosomes therapy. And this treatment is not just for those who already suffered with COVID. We're actually able to offer to patients who are on home quarantine as well. So, for example, your COVID is a bit of watch and wait policy, isn't it? You wait and wait for it to get worse, or it might not get worse. So what we're trying to offer is an alternative to that. So for example, you're at home, you're feeling a bit breathless, but you're still quite stable and you could stay at home. You could seek out to us, and what we could do is we could basically, stem cells can be delivered to your body intravenously, which is through a drip, whereas exosomes can be delivered into your body through two ways, through a drip and through a nebulizer. Nebulizer is basically a machine that a lot of those chronic lung disease patients use. You put the medication into a machine and you aerosolize it so that you can inhale the product. So exosomes can be delivered through a nebulizer. Now, if you have COVID and you're suffering at home, but you're not sick enough to be in a hospital, but you want to do something in the meantime and not just watch and wait, you could contact us and we will do a telemedicine. We will ask more about your history and everything over the phone. And one of your family members can come to the clinic to purchase the exosomes and the nebulizer machine, and you can do it at home. Or
so I guess in short, the government is just like struggling to fight COVID infection, but there's this whole other spectrum of people who are suffering from COVID, which I guess they can't put their resource behind it, and the impacts of not addressing it sooner than later is going to be long term.
Yes, so we've actually given quite a lot of exosomes therapy to those who suffer with post-COVID syndrome, for example, hair loss and muscle ache. And because stem cells and exosomes, it has the ability to modulate your immune system. It is very anti-inflammatory, which is what we keep banging on about. COVID causes inflammation, whereas stem cells and exosomes are able to dampen that. So we've seen quite significant improvement in patients who had COVID after receiving a few doses of exosomes in our clinic, and they actually is much better and they recover from it. I think what people need to understand is that scarring is something permanent unless your body can heal itself. Now the issue is your lungs, your heart, they're not very good at healing itself, which is why you need to seek external therapy to help. So I think regenerative medicine, which is what I'm talking about, stem cells and exosomes, is a topic that people are not really touching into.
Yeah.
It's fairly new branch of medicine, but it offers you hope because it can help heal your organs essentially.
Yeah. I mean, even myself, I wasn't aware about this until I spoke to you. And it's
Yeah.
so we got Ricky Lin here. Hi, doctor. My mom had her first dose of Pfizer on 25th of May. Tomorrow will be going for a second dose. However, till today, her arm is still sore. So this is more of the injection itself. Is there a reason why you sore for so long?
I think if it depends on your muscle bulk. So we are seeing less side effects in big, strong men with a very good muscle bulk because the medication can be absorbed well. Whereas in slightly more frail elderly women with lower muscle mass, the concentration of the medication is much higher in a localized area. So you might have the side effect for a longer period, but nothing to worry about.
Okay, sure. And I noticed that the needle was a thin needle to go below the muscle.
You go into the muscles.
Into the
Into
muscle.
the. Yep.
Okay. Oh, so we've got one from Paulus Rumor. No. Since the AZ might give blood clot issues, shouldn't people take some precaution tests before taking AZ? So I think you've addressed this, but I guess, is there any test you can run to know that you are prone to blood clots? Yes or no?
I guess you could do a clotting profile to look at your clotting markers, but I don't really think it's necessary.
Okay. We got KY Gun here. Hi, Gun. Does full course of vaccination suppress all chances of COVID infection, or will it just lower the severity of the infection symptoms?
Okay, thank you for the question. This is a very good question, okay? So just to re-emphasize, vaccine doesn't prevent you from, that's not the goal of the vaccine. The goal of the vaccine is not to prevent you from not having any symptoms at all. The goal of the vaccine is to prevent you from getting severe symptoms. So I would say it will lower the severity of your infection symptoms.
Okay. And we've got Mr. Bobby Young here, the man himself.
Oh.
Can someone take AZ, Pfizer, Sinovac, Sputnik? What will happen if they take all by the period recommended shots? I heard from sources in TikTok that you become Thanos. Is that true?
Okay, I do not have any paper that has investigated that, but based on logical scientific analysis, I would think as you get each vaccine, your side effect from it will be worse and worse and worse. Because if you've already mounted a response to your first completed vaccine, you take more vaccine again, you introduce your body to the same thing again, your body is going to go into overdrive, overheat as it goes on. So I don't think you'll become Thor, Thanos.
Thanos. You could die like him, though. That's possible. So we've got Derek here. For those recovered patients and tested negative, will he or she get infected again? Not sure if it's asked before. So we have answered this, but maybe if you just cover it again.
Possible. As I mentioned earlier, the COVID virus keeps mutating, keeps creating different strains, so you will still be susceptible to the infection.
We got Chin Shi Chun here. Is there something we can do besides just waiting? If we are COVID-19 positive and on home quarantine, can we boost our immune system to have a chance of better outcome? Thanks.
Okay, so I wanted to highlight like what I highlighted earlier. So we have stem cells and exosomes treatment. This can be given for those who want prevention against COVID. At the end of the day, if your immunity is very strong, even if you're exposed to the COVID virus, you might not develop any symptoms from it because of strong immunity. So if you could do something to boost your immunity before you get COVID, that is great. And what we could offer is stem cells and exosomes. Now, if you are COVID positive and you're on home quarantine or post-COVID, like I mentioned earlier, you can have exosomes delivered via nebulization, means you inhale the exosomes, or you can have a drip of exosomes and stem cells. Now, both of that treatment will help boost your immunity and speed up your recovery from COVID.
So even people who are not positive, they can actually take exosome just for like general health.
Definitely, because it stimulates your body to develop a good immune immunity, and it stimulates your body to go into repair and healing. Repair and healing and regeneration is something very precious to humans because we age every day. You know,
And we don't get enough sleep, I guess. I heard that sleeping is one of the best ways for your body to have ability to recover. And I
definitely.
guess in today's life, people are not resting enough, not enough sleep,
You
not
need
enough
healthy
rest.
diet.
Yeah.
So yeah, if you want an immunity booster, stem cells and exosomes is very good for that.
This is a new one. Should we take blood thinning medicine like aspirin before taking vaccine?
Okay, aspirin is an antiplatelet. Okay, it's usually given to heart patients who's had a heart attack and all that. Just taking aspirin right before you take the vaccine offers no protection whatsoever. If you're talking about really thinning your blood, it's an entirely different ballgame. It's an anticoagulant like warfarin and rivaroxaban. So those are different things. But I wouldn't recommend taking an aspirin before vaccine. Aspirin might be a good painkiller for you before the jab, but it wouldn't really thin your blood, and yeah, it wouldn't really affect the outcome.
We got Arthur Leong here.
Yep.
What are the symptoms of having blood clots? So this is I had a question because when you
Yep.
go to take the vaccine, you wait for 15 minutes. They'll
Yep.
see if you're okay, then you let you go. But once I go home, how will I know I have a blood clot? I mean, obviously, if I pass out, it's obvious. But what are the symptoms that I could probably see myself?
Like I said, blood clot can either form in your artery or your vein. Your body is filled with artery and vein, all right? Artery supplies blood, vein drains the blood. So, depending on where the clot is formed, you'll have different symptoms. If you have a blood clot in your leg, then you'll have a muscle ache. Like, for example, at your calf will be swollen and tender if you have a clot in your leg. If you have a clot in your the vessels that supplies your intestines, your colon, then you have an abdominal pain or diarrhea. If you have a clot in your lungs, then you have difficulty breathing. If you have a clot that goes to your heart, then you'll have a heart attack. Clot that goes to your lung, to your head, you have a stroke. So it's
Stroke.
really hard to say.
Sure,
But
sure, sure.
basically, if you go home and you can't breathe, you collapse, you feel very, very unwell, you have extreme pain in your leg, anything that's out of the ordinary, you should go and seek medical advice.
Yeah.
Yeah.
So we got Mark Francis here. I wonder who this guy is. So he says good. Those who know, great question. Like the answer for that. So this is about the therapy you have. So yes, I think it's an excellent way of boosting your immunity. Go and see doc when you're free. So we've got one from Gary Chin here. How long is the immunity naturally obtained from recovered COVID patients? Are there any natural immunity from COVID?
At the moment, like 3 months, up to 3 months,
So,
towards the same strain.
so once you have COVID, I mean you have COVID, you get COVID infected, you
Yep.
become immune to COVID to that strain.
You have some kind of immunity towards COVID, but that doesn't mean you can go around kissing everyone without a mask, without taking precaution, you know. You still have a small chance of catching COVID, but the likelihood of you contracting COVID again within that 3 months is quite low.
So we got
Yep.
one from Derek again. Different countries accepting different vaccines. Does that mean take different vaccines? So yeah. So like for example, Thailand is saying any vaccine, but some
Yep.
country might impose certain vaccines. Will that be a thing? You must take a particular vaccine to a particular country, or are they all the same?
Well, for example, in China, you kind of need to have had their vaccine before you can go in. I think there's an element of politics in that. But I do foresee people needing to take booster jabs, just like how you would take a cholera vaccine jab or special jabs before you go to South Africa, before you go to Africa, or before you go anywhere. You know, in the future, there will be specific vaccines that are tailored to that country.
Okay, so we
For
got one
example,
more
a
from
vaccine in the UK is yep.
yeah. So sorry, cut you there. So you got John Calvin Koo. A lot of questions here, and I think they're all very interesting. I want to cover them as much as possible. Got a message from a WhatsApp. You can't take vaccine and anesthetic at the same time. Is that true?
Vaccine and anesthesia, completely not true.
Completely false.
Anesthesia local anesthetic acts on your sodium gated channel receptors, which is a completely different mechanism to how the vaccine works. So no, not true.
Okay. So Siva asks again, he's on warfarin and aspirin. Should I increase the dose a bit to dilute?
No, definitely not, Siva. No, if you're on warfarin, you need to have your INR within range. Keep your INR within range. Don't deviate from it. Do not increase your dose.
Don't be a doctor.
Yes.
Okay. Do you trust random messages from stranger or a medical professional? Obviously, a doctor. So we got Dr. Diana here. Trust Dr. Diana. Contact her after this if you need therapy treatment. So we've got okay. Any advice for those choose not to get vaccinated? Reason: afraid of long-term side effect. Not enough medical trials. How much more medical trials do you need? I mean, I think half a year ago is true, but now I think we got a lot of case that's been vaccinated. So I think, yeah. Can I know where clinic is? Yeah, good one. So you want to do a shout out for your clinic, your address,
Yep.
and where you're located?
My clinic is called Essence Clinic, AESSENCE. We're based in Ara Damansara Pacific Place.
Okay.
Is there a way to leave a link to or clinic?
Well, I could probably type out in the banner. So yeah, so just spell out for me.
Yep.
I'll type it out. So that's
SSENCE.
AESSENCE, Essence Clinic.
Ara Damansara.
1 second. So yeah, so look for Essence Clinic Damansara, and you can find Dr. Darren Lim to ask more questions and get treatment to boost your immune system. Or if you have, if you're suffering from COVID, you could take the required medication. So we've got, yep. So yep, that's Kumar. What else? What else? So we've got Brandon Lim. Okay. I caught COVID back in March and recovered, but now suffering from hives, rashes, and trouble breathing. If I'm not on antihistamine, would the stem cell treatment help?
Definitely. As even KKM has released the banner on post-COVID syndrome. Okay, because COVID is a very big stressor to your immune system. Your immune system basically goes haywire. Instead of working how it should be, it's going in an overdrive. Your skin rashes, because when you have skin rashes, basically what I think you have is a form of dermatitis and inflammation of your skin. At the end of the day, it's inflammation. It's your body's immune system going haywire. Now, what I mentioned earlier, stem cell has the ability to modulate, regulate your immune system, and it's anti-inflammatory. I don't think you can rely on antihistamines for the rest of your life. So do come to my clinic and we can chat more about this.
Yeah. So we got two linked messages over here. So one from Gary Chin. He spoke about ivermectin, which he spoke of earlier. And we've got your partner here, Dr. Chin here, talking about, yes, stem cells and exosomes helps. And I think they're both different. One is an extreme case, dire state. I'm hopeless. This is what we have as doctors to give to patients. And the other one is more of building up your immunity. One is to, if you're not infected, is to repair your damaged cells to combat COVID. So they're all both two different things. And I guess one is more from the private sector because it's a more advanced treatment, and one is from a mass available treatment because that's what the government can actually do. So I mean, the blunt truth is, money makes the world go around, and so does medicine, I guess. Yep. So we got T Guan Lau, Diana. My mother-in-law is going for a second dose tomorrow. I'm trying to cook bak kut teh for her Saturday. Is it okay?
Yeah, go ahead.
Go ahead, bak kut teh. If you can invite us, we'll come along and have bak kut teh with you. Or send to us. Sorry, it can't come there, isn't it? We've got Simon Low here. Is there any point to get a spike protein vaccine if the virus keeps mutating and may cause the initial vaccine to be ineffective to protect against symptoms? Wow, this is a tough one. What does it mean?
Okay, so like I said earlier, Pfizer and AZ has actually been shown to be effective against the new strains, fortunately. Now, it is very important to get vaccinated to the current spike protein, which is the original form of the vaccine, because those strains are still running amok in the country. So you want to have a vaccine that will protect you for this period of time. in the future, if the vaccine has been shown through research that it's not effective against certain highly mutated strains, the mRNA vaccine from Pfizer can just be tweaked within a week and you can get new vaccines just like that. So which is why I said that the possibility of getting new types of vaccine in the future is definitely possible, just like the flu vaccine. Every year in winter cold countries, you get flu vaccines every year because the virus mutates. That doesn't mean you don't take the vaccine just because it keeps mutating, you know?
Yeah. So this links back to Daniel Yap here. Yes, the answer is there will be a continuous year in, year out booster shots, depending how the country rolls out the plan, I guess, you know.
Yeah.
We got one from Chin here, Chin Sui Hu. This is a very famous painter, artist in the automotive scene. Hi, Diana and Thana. Blood clot can be asymptomatic, meaning it can happen but not severe enough for me to know and go away by itself.
Yeah. Can. It depends on how big your blood clot is. If your clot is very small, it might just stay there. You might not know it, and it will be absorbed by your body.
So if you want to go to and check out Essence, go check out the website. It's essence.com.my, .my and /about-us. We'll leave the link in the comment below. You can check out after the session itself. So we have also Bobby Young also giving the same thing. So a lot of supporters here coming and helping us to promote. Thank you, Bobby, for shout out. Yes. People like Bobby who are probably suffering from lack of sleep because he works so hard and late at night watching YouTube videos, you should get
come for an immune booster.
Yeah, immune booster, Bobby. Okay, we got Gopala Krishnan here. Hi there, just curious. Alpha and beta virus, are they airborne? What is this all about?
I'm not too sure about that.
Yeah, I'm not sure.
What do you mean by alpha and beta?
Yeah, I don't know. I know alpha, beta, theta. Okay. We've got Mr. Gunn itself. How likely COVID vaccination will be offered in private clinics? So I think right now Sunway is one of the appointed centers. So what's happening is they're trying to get more and more out. When I went for my vaccination in Bangi, it was by Qualitas. So it wasn't even by the government. It was outsourced to Qualitas. They were doing the vaccination for them. So I think, yeah, it's going to come. So we've got a question from Non Chan. What does the clinic specialize in? Is there any specialty? So I guess Essence Clinic, what do you actually specialize? You mean there's a lot of array of stuff that you do, and this is only one of.
We're mainly we're an aesthetic clinic and regenerative medicine clinic. So we also do medical checkup. We're still a GP clinic, okay, but we do aesthetic stuff and we do regenerative medicine.
So these are cutting edge technology. It's new in the market. There are not many people who are actually doing this in Malaysia. So yes, Bobby, it's an immune booster. It's what you need. You know, it's like a turbo power. Press button and it's turbo. if Mike does tuning for your cars, you know, she will come and tune your brain for you.
You can come to my clinic for a body stage 2, stage 3 tuning.
Wow. Okay, we are really passing our 10 o'clock mark there because there are a lot of questions over here. We'll do a few more and then we'll call it a day. If you like this content, please leave a comment that you enjoyed this, you like this, share this video after the session. And who knows, we might bring Dr. Dana back the following weeks. So we've got a few more and then we'll wrap it up. We've got from Tiban. The new mutations is called alpha and beta gamma. Oh,
okay, I get what you mean. Yeah, because WHO tries to destigmatize. They don't want to call it the South Africa variant, the India variant, so they call it alpha, beta, yeah. At the moment, I'm not too sure actually whether they are airborne. I do need to look into it because they are still quite far away from us. So I'm just focusing on just get your vaccines. But I'll definitely look up on that, Steven.
Yeah. So and the last question again from again about regenerative treatment. So I guess you spoke about that earlier about I guess it's preparing yourself.
Regenerative treatment is basically trying to defy the odds of aging, okay? Trying to be able to have a treatment that would help repair and regenerate your body. Regenerate and in a sense that, not to say I can rewind 20 years of your life, but definitely stops the aging, delays the aging and helps heal your organs. Yeah.
Okay. So we had a fantastic time with Dr. Diana over here. Thank you so much, Diana, to spend time and to be with us, to I guess to share your knowledge. It's been a very fruitful session. I've learned so much. I thought I knew a lot, but apparently I don't know enough. So thank you again. Last parting words before we call it a day.
Go and get your vaccines. Don't give up on the government. You will get your turn to get your vaccine, and try and encourage your friends and family to register for it. Vaccine is our only way out, unfortunately, because we cannot afford a prolonged lockdown.
Okay.
Yep.
Okay, guys. As always, thank you for joining us. And as I would end my video, is go out there and have a little more fun. Bye, guys. Bye.